If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what is type 1 and type 2 diabetes? Answer by Prem Prakash Gupta. Diabetes mellitus has been divided in type 1 and type 2 as given below. Type 1 diabetes mellitus. It is also known as insulin-dependent DM, IDDM, or juvenile-onset DM. It is seen in childhood. It results from absolute deficiency of insulin due to destruction of beta cells. 2. Type 2 diabetes mellitus. It is also known as non-insulin dependent DM, NIDM, or maturity-onset DM. It is seen in middle-aged persons/adults, greater than 40 years. It results from either relative deficiency of insulin, due to dysfunction of beta cells, or insulin resistance. It is most common type of diabetes. In type 1 diabetic patients, the acute complication of uncontrolled diabetes is ketoacidotic coma, which may lead to death, whereas in type 2 diabetic patients, the acute complication of uncontrolled diabetes is hyperosmolar coma. Differences between type 1 and 2 diabetes mellitus are given in following table. Ref. Textbook of Biochemistry with Biomedical Significance by Prem Prakash Gupta, CBS Publishers, New Delhi, 2nd edition. Answer by Bharat Shroff. Both type 1 and type 2 diabetes is a health condition of having higher than normal blood glucose levels. The cause and the associating conditions are, however, different. As a general observation, people with diabetes either have a total lack of insulin, which is the stage of type 1 diabetes, or their body is not producing enough insulin. Type 2 diabetes is a stage when you cannot use insulin effectively. Type 1 diabetes, also called insulin-dependent diabetes, type 1 stage accounts for about 5 to 10 cases out of 100 people diagnosed with diabetes. In type 1 diabetes, body's immune system destroys the cells that release insulin, eventually preventing insulin production in the body. Without insulin, cells cannot absorb sugar, glucose, which they need to produce energy. Type 2 diabetes. This stage of diabetes is also called non-insulin dependent and can develop at any age. Vast majority of people with diabetes falls under type 2 diabetes. Around 90 to 95 people out of 100 are type 2 diabetic. This health condition refers to the inability of the body to utilize insulin, which is also called insulin resistance. As type 2 diabetes gets worse, the pancreas may make less and less insulin. This is called insulin deficiency. Both diabetes type 1 and diabetes type 2 increase your risk of other health complications like heart disease, stroke, and foot or leg amputations, as it becomes difficult to manage blood sugar levels within a normal range. You can get in touch with the Diabetes Care and Management Solutions that can help you both monitor your blood sugar levels, as well as provide an expert educator to keep your health in check. Answer by Subhardi-Set. Diabetes is a type of disorder in which accumulation of glucose orders in the circulation. The blood sugar level is controlled by the hormone insulin, which is secreted by the pancreatic cells. The glucose uptake by the cell occurs due to this hormone. A high level of insulin indicates bed state. The cells have different types of receptors, namely GLUT1, GLUT2, GLUT3 and GLUT4. Release of insulin causes these receptors to move towards the cell membrane and allow the passage of glucose in the cell. The diabetes can be of two types. In type 1 diabetes, there is low level of secretion of the insulin. As a result, the receptors of glucose do not migrate to the cellular membrane to take up glucose. Thus the blood glucose level rises. In type 2 diabetes, normal level of insulin is secreted. But the cells develop a sort of insulin resistance, which prevents the glucose from entering the cells. Hence increased blood glucose. In such conditions, excess glucose is excreted in the urine. The condition is called hyperglycemia. These are in brief the type 1 and 2 diabetes. Hope it helps. Cheers.